Human life operates on a chemical tightrope. Right now, the pH level of your blood sits in an incredibly narrow window between 7.35 and 7.45. If that number shifts by 0.1, the proteins and enzymes responsible for metabolic reactions warp out of shape, deform, and shut down completely. We live our entire lives inside these exceptionally precise machines, yet we often treat them like sealed black boxes. Most of us only pay attention to how our biology actually functions when a routine health check throws a red number our way. To make sense of that machinery, we typically consult two very different instruction manuals. This graphic contrasts those two approaches. On the left, Western medicine tracks specific liver enzymes to pinpoint cellular damage. On the right, Eastern medicine evaluates the entire system's energy flow through diagnostics like the pulse and the tongue. Relying on just one of these manuals leaves massive blind spots. To prevent a catastrophic biological failure, we have to stop choosing sides and learn to read both languages simultaneously. When a specific part breaks, Western medicine excels as a biological detective. It zooms in to find the exact localized crime scene, often starting with the most critical pump in the system, the heart. This table compares two distinct types of chest pain that require entirely different responses. On the left is angina, which occurs when a coronary artery is partially narrowed. The pain is brief, and a nitroglycerin tablet relaxes the vessel walls to restore flow. On the right is a myocardial infarction, a total blockage that causes tissue death. The pain is prolonged, and nitroglycerin has no effect. To definitively prove that total blockage has occurred, doctors check the blood for specific cellular debris. Notice the bottom right of the chart. When heart muscle cells rupture, they release markers like CPK and troponin I. A spike in these values provides undeniable evidence of active tissue damage. This pinpoint precision extends from chemical data to mechanical testing. You can think of the human nervous system exactly like the electrical fuse box in your house. This diagram shows how physical orthopedic tests map directly to that internal fuse box. If a doctor taps your knee and the reflex is gone, they don't need to guess where the problem is. They know immediately that the specific nerve connection at the L3 and L4 lumbar vertebrae is being compressed. By tracking chemical markers and mechanical reflexes, Western precision gives us the exact coordinates of a physical breakdown. But localized diagnostics can fail when the body's alarm system misleads the observer. Sometimes a symptom appears in one area despite the actual damage being located elsewhere. Take a blocked gallbladder. You would expect the pain to be centered in your abdomen. Instead, because the sensory nerves for the gallbladder and the right shoulder enter the spinal cord at the same level, the brain misinterprets the signal. It triggers an intense, inexplicable pain radiating entirely in your right shoulder. This kind of systemic confusion also happens when an internal shortage forces a healthy organ into overdrive. This illustration shows how an endocrine imbalance disrupts the entire machine. On the right, hyperthyroidism accelerates the body's metabolism, much like how severe anemia depletes oxygen-carrying cells, forcing the heart to race wildly just to keep the system functioning. If a doctor listened to this patient's chest, they would hear incredibly loud heart sounds, but treating the heart directly would be a mistake. The heart is healthy. It is simply compensating for an imbalance elsewhere in the system. When an entire system is overcompensating, looking at a single distressed organ leads to an incorrect diagnosis. You need the macro view of Eastern medicine to observe the whole system, rather than focusing on a single stressed component. These two medical languages are often framed as opposites, but they serve as highly complementary tools. This infographic outlines how they overlap, connecting Western molecules on the left with Eastern herbs on the right. Look closely at the hemodynamic section in the center. Here, we see Western medicine using aspirin to prevent coronary disease, while Eastern medicine employs the herb pu hong. Aspirin does a specific job. It lowers blood viscosity to prevent clotting. Pu hong, however, achieves a systemic dual action effect. It possesses anticoagulation properties, but it also contains mechanisms to promote blood circulation and nourish the surrounding vessels. This dual approach is essential when managing the side effects of life-saving interventions. Western drugs routinely clear immediate dangers, but create systemic imbalances over time. Long-term use of steroids can lead to Cushing syndrome and extreme weight redistribution. Statins successfully lower cholesterol, but they can damage the liver as a byproduct. This is where Eastern medicine steps in. The goal is not to replace the necessary Western drug, but to restore liver function and manage the systemic inflammation or heat that the treatment can leave behind. Western medicine provides the high-pressure tools required to clear a blocked vessel. Eastern medicine provides the maintenance to keep the body's organic filters functional. Consider an emergency room doctor trying to correct the deep, rapid breathing of a patient in diabetic ketoacidosis. Now compare that to an acupuncturist working to calm the nerve tremors associated with Parkinson's. They are using different manuals, but this central diagram reveals the core truth. Both practitioners are fighting for the exact same biological state. That state is homeostasis. To achieve true health, we must move beyond localized thinking. We have to stop treating the head only when the head aches and treating the foot only when the foot aches. Every chemical shift and mechanical movement in the human body ripples outward, affecting the entire system as a single interdependent unit. Empathetic, inspiring. By adopting both lenses, using the micro data of your cells alongside the macro balance of your entire system, you can begin to accurately interpret the specific signals your body is sending. Learning this dual language changes how you interact with your body. It turns the noise of a symptom into a clear, actionable dialogue with the machine you live inside.